Welcome back to the Neurology channel, your go-to source for all things related to neurology and brain health. Today, we have an important topic to explore: Clopidogrel, also known as Plavix, R. Whether you're a patient, a caregiver, or simply interested in neurological treatments, you're in the right place. But before we dive in, be sure to subscribe and hit the notification bell so you never miss our latest updates. Clopidogrel, marketed under the brand name Plavix, is a medication that plays a pivotal role in the field of neurology and cardiovascular health. In this video, we'll delve into what it is, how it works, and its applications in neurological conditions and beyond. What is Clopidogrel used for? Let's begin by understanding the primary uses of Clopidogrel. Clopidogrel is primarily known as an antiplatelet medication. It's prescribed to prevent the formation of blood clots in arteries and veins. Clopidogrel is often used to reduce the risk of stroke in individuals who have had certain types of strokes or who are at risk of having a stroke. How Clopidogrel, Plavix, R, works for patients. Clopidogrel is classified as an antiplatelet medication, and its primary function is to inhibit platelet activation, thereby reducing the risk of blood clot formation. Here's a closer look at its mechanism of action. Inhibiting platelet activation. Platelets are small cell fragments found in the blood, and they play a crucial role in the blood clotting process. When blood vessels are injured, platelets become activated and clump together to form a clot, which helps stop bleeding. Clopidogrel works by blocking specific receptors on the surface of platelets. These receptors are known as P2I12 receptors. When Clopidogrel is metabolized in the liver, it produces an active compound that binds to these receptors, reducing platelet stickiness. By binding to P2I12 receptors, Clopidogrel makes platelets less responsive to signals that normally activate them. As a result, platelets become less sticky and less likely to clump together. Prevention of arterial clots. Reducing the risk of stroke and heart attack. The inhibition of platelet activation by Clopidogrel is especially significant in the prevention of arterial blood clots. Arterial clots can obstruct blood flow in critical vessels, leading to conditions like strokes and heart attacks. Stent placement. Clopidogrel is often prescribed after certain medical procedures, such as coronary artery stent placement. It helps prevent the formation of clots around the stent, reducing the risk of complications. Clopidogrel is typically administered orally in tablet form. The dosage and duration of Clopidogrel treatment can vary based on the specific condition being treated, the presence of risk factors, and individual patient characteristics. Healthcare providers carefully determine the appropriate treatment plan for each patient. Clopidogrel is generally effective in reducing the risk of blood clot-related conditions like strokes and heart attacks. However, it's important to be aware of potential side effects, which can include bleeding, bruising, and interactions with other medications. Patients prescribed Clopidogrel should maintain open communication with their healthcare providers to assess treatment response, monitor potential side effects, and make any necessary adjustments to the medication. In summary, Clopidogrel, known as Plavix, is a vital medication that works for patients by inhibiting platelet activation and reducing the risk of blood clot formation in arteries. It plays a critical role in preventing conditions like strokes and heart attacks, particularly in individuals with certain risk factors or medical conditions. Patients should use Clopidogrel as directed by their healthcare providers and follow up regularly for monitoring and guidance. Administration and dosage. Clopidogrel is typically available in tablet form. The dosage and duration of Clopidogrel treatment can vary based on the specific condition being treated and the individual's risk factors. Healthcare providers carefully determine the appropriate treatment plan for each patient. Effectiveness and side effects. Clopidogrel is generally considered effective in preventing blood clot-related conditions like strokes and heart attacks. However, it's important to be aware of potential side effects, which can include bleeding, bruising, and interactions with other medications. Patients prescribed Clopidogrel should maintain open communication with their healthcare providers to assess treatment response, monitor potential side effects, and make any necessary adjustments to the medication. In conclusion, Clopidogrel, known as Plavix, is a crucial medication in neurology and cardiovascular health. By inhibiting platelet activation, it helps prevent the formation of blood clots, reducing the risk of conditions like strokes. If you have any questions about the use of Clopidogrel or its potential benefits and risks, it's always best to consult with a healthcare provider. Thank you for joining us on the Neurology channel. If you found this video informative, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more valuable insights into the world of neurology and brain health. Stay well and take care.